The purpose of ABA, as defined by our Washington Administrative Code, is that it assists children and their families to improve the core symptoms associated with autism spectrum disorders and other developmental disabilities. ABA services support learning, skill development, and assistance in any of the following areas or domains: social, behavior, adaptive, motor, vocational, or cognitive. As you can see, applied behavior analysis has been proven effective in many areas and not just in reducing challenging behaviors. A diagnosis can be made by the professionals listed here and licensed under the Title 18 RCWs. They must also have experience in the diagnosis and treatment of autism, as well as use a validated diagnostic tool. They must use the current DSM criteria for making their diagnosis. Under the Washington Apple Health Plan, Centers of Excellence can also give a diagnosis and do a prescription for applied behavior analysis. A COE can be a hospital, medical center, or an individual healthcare provider that meets or exceeds the standards set by the agency. In this program, they would perform the clinical diagnostic evaluation and determine whether ABA services are medically necessary for each individual patient. To be a COE, you must be a qualified medical provider that has been designated by the healthcare authority. This may be ARNPs, physicians, and psychologists that demonstrate expertise in diagnosing autism spectrum disorder, understand the medical necessity use of ABA, and sufficiently qualified to conduct and document comprehensive diagnostic evaluations as well as a multidisciplinary clinical treatment plan. In limited circumstances, the healthcare authority, at its discretion, may accept an evaluation from a qualified medical provider who is not a recognized COE. Also, if you would like to become a COE, training is offered in various locations. If you're interested in either of these situations, please contact the ABA program manager at the email listed below. The first stage of accessing applied behavior analysis is for having the Center of Excellence do an evaluation and order. The child is referred to the COE for diagnostic testing and comprehensive evaluation. Then the COE would order or prescribe applied behavior analysis services. If the COE recommends ABA treatment, this will not be approved and would be denied services. The COE must demonstrate medical necessity and do a prescription for treatment. This is also why a COE must understand the medical necessity use of applied behavior analysis. The required documentation the COE must submit is the report of the comprehensive diagnostic evaluation. The COE must order or prescribe ABA treatment. Remember, you must use the words order or prescribes and not recommends. For patients with an ASD diagnosis, the COE must include the DSM-5 code and attach a completed DSM-5 checklist. For patients with a non-ASD diagnosis, such as developmental delay, a statement of medical necessity and that the patient would benefit from ABA would be required. The COE would provide a copy of the order and supporting documentation to the caregiver. The caregiver also may request that the COE submit the documentation to the ABA provider they have selected. The second stage of accessing applied behavior analysis is the assessment and treatment plan development. The family selects the Department of Health licensed ABA provider. Then the child has a comprehensive assessment conducted by a qualified DOH licensed behavior analyst, otherwise known as an LBA. In the state of Washington, an LBA must be a nationally board certified behavior analyst, a BCBA. Then an outcome-oriented, time-limited ABA treatment plan is developed. It is developmentally appropriate, individualized to the patient, is client-centered, family-focused, community-based, culturally competent, and minimally intrusive. It includes target behaviors, goals, interventions, and objective measures of progress. It incorporates strategies for generalization and includes family education, training, and support. Also, the LBA recommends the dosage of treatment, meaning the hours of services for the treatment to be effective. The final stage is the delivery of ABA services. The caregivers and families are critical in the development of the treatment plan. Once they agree, then the treatment plan is submitted to the MCO. The MCO would make a pre-authorization and determine that services would be approved. The delivery services can be done in a wide range of settings and modalities. It could be done in the child's home, office, and clinic, or in the community. for ages 2 through 20. There is, for ages 2 through 5, an early intensive ABA day treatment program. This is a short-term intensive program for young children. Typically, reauthorization is made every 3 to 6 months. This requires recertification of medical necessity and an updated treatment plan.